Hey, sweetest potatoes. So, every time you hurt yourself or you cut yourself and it hurts, and you see soon there is a change in the color, there is a red color, and sometimes there is heat and swelling, and also there's pain associated with it. So, all the set of symptoms you experience together is what we call as inflammation. Inflammation, it comes from a Latin term which means to set fire on. It is a non-specific defense mechanism to the invasion of infectious agents or any antigenic challenge or even physical damage. Coming to the hallmarks of inflammatory response, so this was described by the Romans about 2000 years ago. So there is swelling, which is also called as tumor, redness, rubor, heat, calor, and pain, dolor. And recently, in the second century, an additional hallmark of inflammation has been introduced, which is called as Galen, that is the loss of function. And there are three major events of inflammation which takes place during the inflammatory response. The first one is vasodilation. So vasodilation, it means there is an increase in the diameter of the blood vessels of the nearby capillaries, which leads to the increase in the blood supply in the infected area. And simultaneously, there also be vasoconstriction, that is the opposite of vasodilation, where there is decrease in the diameter of the blood vessels, and the blood which carry and these vessels carry the blood away from the affected region. And there are mainly two main processes which takes place during vasodilation, that is rubor and calor. And rubor, which refers to the redness, and calor is increase in the temperature in the affected region. So the second process which takes place is increase in the capillary permeability, which is caused by the retraction of the endothelial cells, and it is another major event where there is increase in the permeability, and this allows these larger molecules to escape from the capillaries. As a result, you can see antibodies, complement, and also other plasma enzymes, they reach the inflammatory site, and this leads to the accumulation of a fluid or exuents, which causes swelling, tumor, and pain in the affected region. And the last step is called as extravasization, where there is migration or influx of the leukocytes. So initially the neutrophils come, and after 5 to 6 hours later, you have macrophages and lymphocytes from the blood, which migrates into these capillaries and surround the tissue, and they come and they do their function. So yeah, so the next part of inflammation will be in another video. So if you found this video useful, do consider subscribing, and please like this video, which will inspire us to make more of this sort. And thank you, and stay tuned for the next one.